Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming nursing competitive exams, right? Okay, we'll start today's session with a small quote. A goal without a plan is only a dream. That means a target, right? If you're targeting something, you should have a plan. Otherwise, it's just a dream. உங்கள் கோல் அச்சீவ் பண்ணணும்னா ஒரு ப்ராப்பரான பிளான் இருக்கணும். வித்தவுட் அ பிளான் நீங்கள் ஒரு கோல் அச்சீவ் பண்ணுறது ஜஸ்ட் ஒரு கனவு காண்ற மாதிரி தான். ஸோ ப்ளீஸ் பிளான் ஃபார் யுவர் கோல், ரைட்? ஓகே, டுடே வி ஆர் கோயிங் டு சி அ இம்பார்ட்டன்ட் எம்சிக்யூ அபவுட் த oncology topic. Okay, oncology related questions we are going to see, right? First question, Mr. Ravi suffered from laryngeal carcinoma. Oncosurgeon advised for Asai surgery. The patient asked about it to the nurse. What does the surgery mean? So the Asai surgery. So what does that mean by Asai surgery? The options: it is a partial removal of larynx. It is a complete removal of larynx. It is done to make capable for speech production. It is a type of tracheostomy. So what is Asai surgery? The correct option is option C. It is done to make capable of for speech production. Capable for speech production. So why the Asai surgery is doing? When the patient is having the carcinoma of larynx, what the surgeon will do? They will remove the larynx. So larynx is our voice box, right? So if the larynx is removed, the patient cannot speak properly. So what the surgeon will do? They make a small anastomosis or a small fistula connection to the pharynx to the esophagus, so that the patient can produce the sound while they inhaling some air. So this is Asai surgery. It is a reconstructive surgery developed by Ryoza Asai in 1959. She is a Japan surgeon who invented this reconstructive surgery. So it's a technique for creating a new voice source using a fistula between the pharynx and esophagus. That is Asai surgery, right? So the here Asai surgery means option C, to make capable for the person to speech productions. This is the Asai surgery, right? Okay. Next question. A nurse reveals FNAC results report of Mrs. Anju, a 36-year-old woman. Finding is ductal cell carcinoma. The report showing that ductal cell carcinoma. The nurse understands that it is a type of what cancer? Cervical, ovarian, breast, endometrial cancer. So the correct answer is it is a breast cancer. Ductal, it's related to the duct. So it is related to the breast cancer. We have two types of ductal carcinoma. One is DCIS, that is ductal carcinoma in situ. Second one is IDC, that is invasive ductal carcinoma. Nothing but DCIS, the carcinoma is just in the ducts, that milk ducts, okay? So it's not in metastasis or any other part, just in the duct only. So IDC is invasive ductal. So it invade to the further areas. You can see it in this picture. The DCIS is a ductal carcinoma. Only the milk ducts are having the carcinoma. But in the invasive ductal carcinoma, the cancer spread to the other parts of the ducts and the breast. Okay. So here the correct answer is ductal means it's a breast cancer. Okay. Yes. Next question. A nurse giving health education to a patient of lymphoma regarding care of sight. Okay. The nurse tells patient about which action should not to do in care of skin. So here the patient is having a lymphoma, is going for any radiation therapy or a chemotherapy. Okay. So what should the nurse educate to the patient? Option: do not shave the area, wash the irradiated area with a mild soap and water, use clean soft cloth to dry it, apply lotion oil on the area of irradiation. So wherever the radiation has given in that particular area, the care should be given properly, right? So here the question is should not to do. So here the correct answer is option D, applying lotion oil on the area of irradiation. Why? So coming to the other options, do not shave the area, right? We should not shave that area. The skin damage can happen, cut can happen. So we should not shave the area. Wash the irritated area with a mild soap and water. We try to avoid the soap, but in case the patient want to use soap, we can use a mild soap. So that is also a right answer. Option C, use clean, soft cloth to dry it, right? So why should not we should not use lotion oil? So what will happen in the radiated area if you use lotion and oil for in that particular area? There is a chance of radiation will be absorbed more in the skin that can leads to radiation related to dermatitis. Radiation related dermatitis. So to prevent the dermatitis, we should not apply any lotion oil on the area of radiation, right? So the nurse has to educate this one, right? Okay. Next question. Mr. James is suffered from gastric cancer. Oncosurgeon advised him for gastroscopy. Post-operatively, which of the following vitamin is necessary to administer Mr. James? It's a easy question. Vitamin K, vitamin A, vitamin B6, vitamin B12. The correct option is vitamin B12. Post-gastrectomy, what will happen? The observation of vitamin B12 will be reduced. Why? Because our gastric area, that means our stomach, will produce intrinsic factors. So the intrinsic factor will absorb more vitamin B12, right? So if the stomach is removed, that is what the surgeon will do in the gastrostomy, right? Either it's a partial or total gastrostomy. What will happen? There is a chance of vitamin B12 deficiency because of lack of intrinsic factor. So these patients will be provided with vitamin B12 either orally or IM or IV. Sometimes the patient may require intrinsic factor also, right? Okay. Here the correct answer is option D. Next question, which is the commonest site of metastasis of colorectal cancer? Which is the most common site of metastasis colorectal cancer? It is option A, liver. Most common site of metastasis for colorectal, more than 40 to 50% of the colorectal cancers will develop and metastasis to the liver, because liver is the first location uh, when the portal system is involved in the metastasis. Whenever there is a portal system is involved, directly it affects the liver. You can see it in these studies. 50 percentage, 40 to 50 percentage of the cases that the colorectal cancer will affect metastasis to the liver. Okay, that's all about today's session. Thank you all. I hope you understand and you learned something new in this session. If you like this class, please press like button. If you have any doubts, please type it in the comment box. If you are new to the this YouTube channel, please kindly subscribe to our channel. We'll meet you in the next session. Thank you all.